Hello, good morning, good afternoon, good evening, everybody. Welcome. We're going to get started in just a few minutes, but I want to invite everyone to go ahead and introduce yourselves in the chat. We'll get started in a few minutes. Thanks. All right, let's go ahead and get started. Hi, everyone. Good morning, good afternoon, good evening. Thank you all so much for joining us today for the fifth and final session of Momentum's webinar series, Strengthening Analysis and Use of Routine Health Facility Data for Maternal, Newborn, and Adolescent Health. We're so excited to have you joining us today. And like I said, we welcome you to introduce yourselves in the chat. My name is Emily Stammer. I'm a Senior Research Monitoring and Evaluation Advisor with the Momentum Knowledge Accelerator Project. I'm so happy to be here with you all today. Before we dig into today's subject matter, which is data visualization, I want to go over a few housekeeping items just in order to provide everyone with the best experience possible. Next slide. First, please note that today's webinar and all the sessions during this series will be recorded and posted to the Momentum website. So if you're not able to attend any of the sessions or weren't able to attend one of the previous sessions, you will be able to access the recordings and materials shortly after each session takes place. All of the sessions today are in English. So if you stay in this main channel, you'll hear the presenter speaking in English. If you'd like to hear the session in French, please click on the interpretation icon at the bottom of your screen and select the French channel. On a related note, the slides that will be presented on the screen today will appear in English. My colleague Zach will share links in the chat to English only and French only versions of the slides so that you can follow along with the presentation if you'd like. We'll aim to give verbal cues to note when to progress to the next slide. Lastly, there will be a single break for questions and answers during today's session after all the presentations are complete. Please click on the Q&A icon at the bottom of the screen to submit any questions you may have. We'll do our best to respond to questions either directly in the Q&A box or during our Q&A break. And then with the housekeeping out of the way, I think we're ready to begin. Next slide. So the purpose of this series is to introduce you to resources and tools to strengthen the analysis and use of routine health facility data for maternal, newborn, and child and adolescent health programs in your work with country stakeholders. Routine health facility data are an important source of information for decision makers to understand service utilization and service quality so that they can identify problems and make evidence-based decisions on policies and resources. In an effort to strengthen the analysis and use of health facility data for MNCAH programs, the World Health Organization developed a guidance document and an accompanying resource package to be used for capacity strengthening in workshop and webinar settings such as these. The guidance document describes a catalog of indicators for MNCAH that can be monitored through routine health information systems. And it also provides guidance on analyses and visualizations for the indicators. The document also includes considerations for program managers for interpreting and using the data for decision-making. The Momentum Knowledge Accelerator project has adapted those materials for this Training of Trainers webinar series. So over the course of this series, we have examined different components of the WHO toolkit to show you how to access and use the resources. My colleague Zach will share a link in the chat, and there's also a link in the slides today. But in today, our final session, you'll also hear some practical examples from Momentum projects to help illustrate how the concepts covered by this series can be put into practice. And we'll highlight other existing resources that may help support your work. Just a note that while some of our colleagues from the Momentum Awards were involved in reviewing some of the materials presented today from the toolkit, and we can answer some questions about the subject matter, we personally are probably not best placed to answer questions about why certain content was included or excluded from the toolkit. But for those questions and others, I invite you to reach out to the WHO using an email address that Zach will put in the chat. Next slide. So during today's webinar, we'll be looking at the components of the 5th module, or one of the components, which covers data visualization. Next slide. Just a reminder that each webinar in this series has had a similar structure and includes the same core components. So we begin with an introduction to key concepts and highlight different tools and resources that are available to support your work. We focus largely on the WHO toolkit, but we also highlight other resources at the end of the first presentation. We then hear from staff at different Momentum Awards and other external groups on how they've put these key concepts into action in their work and suggestions and lessons that they can share with you. And then we leave time for questions or a bit of discussion. So today's session, as I noted, focuses on data visualization. And briefly, for those who missed the first 4 sessions, they covered an introduction to health facility data, data quality considerations, data triangulation and analysis, interpretation, and use. And these presentations and recordings in both English and French can be accessed on the page dedicated to this webinar series that are on the Momentum website. So without further ado, I want to introduce today's presenters. I've already introduced myself. I'm Emily Stammer, and we have the pleasure of hearing today from Wyclef Waweru, who is the head of monitoring with Momentum's private healthcare delivery project. Next slide. Oops, sorry, that's our presentation slide. Okay, next slide. Thanks. So the objectives of today's session are to provide an overview of the importance of data visualization to support your partners working with routine MNCAH data, to present and discuss real-world examples of how our Momentum colleagues have approached this work, and then to highlight key tools and resources that may be useful to you when supporting partners doing this work. Next slide. So let's start out with a little bit of trivia about data viz just to get our brains working today. So first question, and I think Dakota will launch the first poll. What proportion of the world's data was generated in the last 2 years? Was it 30%, 50%, 70%, or 90%? Or you don't know, but it's probably a lot, considering how much your aunt or other family members post on Facebook, because that is considered data. You can just vote right there in the poll. Okay. Dakota, can we show the results? Okay. All right. Don't know the number. It's probably a lot. I like that that one got the most responses. So it's 90%. So 90% That's a lot, right? We're generating data at a ridiculously rapid pace these days. Data are everywhere. And, let's be honest, as I mentioned, a lot of data are kind of garbage that nobody really cares about. And all the Facebook posts or, that kind of thing. But a lot of data are important and could be really useful if analyzed and presented appropriately. Next slide. And we'll launch this poll. One more question for you, and then I won't quiz you anymore. So why is visualizing data useful? Is it because visualizations help guide the reader? They appeal to visual learners? They help break up the monotony of text? They may be useful for low literacy audiences? They help convey messages and comparisons that could be difficult using text? Is it all of the above? Or you don't know and you didn't think you'd have to read so much this morning? And sorry for that, there is a lot of reading. Give you a few minutes. And if you can't see the French translations, you might need to just expand your window of the poll a little bit. Okay, Dakota, you want to show the results? Okay, lots of correct results on that one, all of the above. But if you answered the ones above, you were right too. So everybody wins this morning. So yeah, all of the above, all of those are reasons why visualizing data could be useful. And we'll talk through some of those today. But I do want to caution that data visualization can be useful, but it has to be done correctly and it needs to be clear. Otherwise, visualizations can be misinterpreted and aren't as, don't meet your needs and the needs of your audience. Next slide. So now we'll get into a bit of the context and the background here. So I just want to note the WHO toolkit doesn't get too much into thinking through why you want to do visualizations before you do them. But I thought it might be helpful to touch on that briefly before just assuming that data viz is the right way forward. So one study by Ng and colleagues in Tanzania found that honestly, most decision makers looking at graphs hadn't had any statistics or data use training since university. So they had trouble pulling out main messages from the visualizations. And from that study, it helps us understand that data literacy is really an important thing to consider when deciding whether you need a visualization. When you're making that decision, you want to think through and consider whether text or a table might be more appropriate instead. So then it's important to know and to think through what's already understood from the data you have in front of you. What does need to be communicated and what's already clear to your audience or user? And then what level of detail do you need? And here is honestly where I'm guilty and many of us who love data are guilty. We dig down deep into data sets and we want to throw all that we've learned into a graph, but really think through what you want your audience to know and use that to guide your graphic. And put as little detail into it as you need. More detail than necessary also tends to just crowd things and make graphics harder to read and interpret. So let what you want them to know guide the process, and then also think through the actions you want or expect them to take as a result of the visualization. If you're having an issue with data quality in a facility and you want your audience to get that message, you could show them the proportion of missing data fields for a given indicator over time. Finally, what's the purpose of your visualization? Are you trying to explain a trend or a phenomenon, or are you exploring it? Are you trying to show them that the proportion of women attending 4 or more antenatal care visits decreases in the rainy season? Are you explaining, or are you looking at antenatal care trends over time and working with your teams and your health facility workers to determine why visits are declining at certain time points. So these are all useful things to work with your teams to help guide whether and how you visualize data. Next slide. I'm sorry, this is a little bit hard to read, but the WHO toolkit kicks off the data viz piece with this graphic on how to decide which visualization to use, suggesting that the answer will depend on what type of information you want to show, whether it's a relationship, a comparison, a distribution, or a composition. I would again caution you when working with your teams to think long and hard about your end user and their literacy levels, their data literacy levels. The study that I referenced in the previous slide found that most country-level stakeholders felt most comfortable with bar charts, pie charts, and maps. We'll look at a few other ways to visualize data, but it's important to keep that in the back of your mind when selecting from the various visualization options. More complex visualizations can be pretty to look at, but if the audience can't interpret them, it's kind of been a waste of time and resources, right? Simplicity, I feel, is really undervalued and underappreciated sometimes when it comes to data visualization. Next slide. So this slide shows a number of different visualizations that are possible and that are covered in the WHO guidance. With bar charts, you can compare categories of data. Stacked bar charts allow you to represent components of a whole and compare wholes or multiple values. Line graphs allow you to display trends over time, and pie charts can show you percentages or proportional shares of a total that equal 100%. And then there are tables, which are useful for summarizing data, usually as absolute numbers or as percentages. Next slide. Other common visualizations, and some that our Momentum Country and Global Leadership colleagues shared a few weeks ago that are useful, are maps. Maps are great, and if done correctly, they can really help get a point across where there is differentiation in indicators by geographic areas. The only downside of maps is that you can usually only show a single time point of data. Next slide. One final example of a visualization that I'll discuss is dashboards, which can be useful when you're displaying several indicators together. One nice thing about dashboards is that your denominators don't have to remain consistent across indicators, but the indicators you're presenting should be related to one another and represent a consistent time period. So clear labeling is really important for easy and accurate interpretation. The WHO toolkit goes into a few more examples and provides a bit more guidance on how to choose which visualization best meets your needs. And we won't get too much more into the background of data visualization today, as I think Wycliffe's presentation does a really nice job of showing what's possible, what they have used, and gives a better explanation of why and how. Next slide. So now I wanted to briefly touch on some of the good resources. And of the sessions I've presented on, I really have had the most trouble with this one, finding resources. There are a lot of data visualization resources out there, but finding resources that really prioritize message clarity, ease of use, and take data literacy into consideration can be hard to find. Additionally, when you look around, a lot of the visualization softwares and even materials are proprietary. So it seems like lots of folks are trying to sell a product. The few resources I've highlighted don't do that, but there weren't many that I could find out there that seemed to meet the need for simple and straightforward toolkits for routine health data. Next slide. One of the resources is the WHO toolkit. The data viz components of the toolkit are focused in Module 5, which touches on analysis, visualization, and interpretation of use. Next slide. There is one example in the facilitator manual that goes over selecting and interpreting visualizations that could be useful to discuss with your teams. It has a case study, and those are helpful to kind of work through to get your teams to think through the best visualization to choose for a set of data. Next slide. The other resource I identified is a more general training toolkit that USAID and Measure Evaluation released a few years ago. It's not MNCAH specific, and it's a little bit dated, but for basic data visualization, it's very useful and very straightforward. The current WHO toolkit draws from this resource, so you'll find some of the content repeated. But this measure toolkit also includes job aids and other tools that are nice. And it has a lot of hands-on exercises too, in case you're looking for that to use with your teams. So then with all of that covered, it's time to hear from our guest presenter. So I'd like to hand things over to Wycliffe Waweru, like I said, who is the head of monitoring for Momentum Private Healthcare Delivery, to talk us about the work they have done with visualizations of routine data and walk us through a demo of the DHIS2 data visualization feature. So Wycliffe.
Thanks, Emily. And it's great to be here speaking to all these people who are both on the program and M&E side of the work. And I'll be speaking about our experience as the Momentum Private Healthcare Delivery team on how we have worked with data visualization. Just as a brief background of the project, the Momentum Private Healthcare Delivery project is part of that Momentum suite of programs. And our role, as you can see on the private healthcare title, is to increase the capacity of private providers to deliver evidence-based and quality care. And so a lot of the work we do is with countries, and as a team, when the program team is looking at all our data, we use DHIS2 as our information system, as well as the place where we access our data and visualize it through dashboards. And so a lot of the examples I'll be speaking about today are actually based off DHIS2. Next slide. And when the program began, we couched our entire approach on how we use data or the purpose of that data. And we know that it's important for the data to be used for reporting, but we believe that the true purpose, the ultimate purpose of that data is to make actionable decisions. And the reasons for those decisions is really to improve the performance of our program. And so part of our monitoring and evaluation strategy, has these three big buckets. And for the MEL teams here, I know a lot of this is familiar to you. We want to focus on people and making sure that everyone who's working within the entire stream, both people with direct MEL responsibilities, as well as program teams that are working on the program, within the program, that we have the right structure, and that the people within the program have the relevant skills and competencies to be able to collect, quality assure, analyze, and use data. We also need to, as a second piece, ensure that our systems and processes for managing the data are in place and are robust enough to meet all the needs of the program. And the final one really is where we'll be focusing, is ensuring that the right information is collected, and once that is collected, that the right teams engage with and use data. And teams, in this case, is typically not the MEL team. They are not the end users of our data. They facilitate the process. They help with ensuring that we've collected and quality assured and analyzed it. But it's the people who are managing and implementing the program who are the end users of that data. And so that is a group that we really want to focus on as we discuss data visualization and use. Next slide. And so as part of this process, we, on the right side, developed a theory of change that governs how we approach data. And at the very top, the outcome that we're looking for is improving the performance of the program. So the scale in terms of both geographical spread and the number of people who can benefit from the program. Looking at the quality of delivery, either of services or the program itself. And then the third is looking at efficiency and saying, are there places where we can begin to have cost efficiencies or reduce wastage through the entire program? And for us to get there, we really need the users of the data, the program team and the implementers to engage with the data, because we often speak about, data-driven decisions, but we can't get there unless teams are engaging on a very regular basis with that data. And so what we look for, the one thing we can measure is whether or not people are engaging with the data. And once we drive that engagement with data, then, invariably to lead to better use of the data. And for us to drive that engagement and use, we need to focus primarily on three things: looking at the opportunity of program teams to access the data. And so as we are working with DHIS2, we ensure that everybody has login access, everyone is able to visualize the data. And so we're looking to increase the ability of our program teams to use data. We walk them through two things. First, at the beginning of the program, we do a data to action workshop with them to help them truly understand the data that they're capturing and help them think through how they might use it and the sort of things they'd want to look out for in the data as they're engaging with it. And then secondly, train them on how to use DHIS2 itself and how to navigate all the different options of how we how to work with the visualizations. And the third thing, is look at their motivation and begin to address, what are the things we can do through the leadership team of the program, and using some subliminal incentives that can help drive their motivation to engage with the data. And so, at the left, you can see the sort of things we have spoken about as our data use strategy. And I'll talk about data to action frameworks in the following slides. But the key thing we do is that we go through this process at the beginning of the program and think through it so that by the time we are actually beginning to configure our information systems, we have taken into account the data use needs of our different audiences. And so as we move to the next slide, I'll be speaking about our data to action framework, which you'll see on the following slide. But really what it is it helps us do three key things. First, it helps us to identify the key performance metrics that the program team are interested in tracking. As you can tell, in a program like Momentum, there's a lot of data, and this may apply not just in Momentum, but also in the other programs that you work in. You will generate a lot of data, but not all of the data that you're generating will be useful for decision making by different people. And so it's important that you think about what are the data use needs of my audience, what are the key metrics that they care about, that this particular subset or this particular group cares about. And in a program like ours, there may be somebody who's dealing with maternal and child health and somebody else who's dealing with family planning, and they all have different needs. So understanding who your end users are and what metrics matter to them is important. We then figure out, for each of these key metrics, what are the benchmarks or what are the targets? Where do you want on a monthly basis, if it's a service delivery program, what sort of client flow should you be having, and use that then to determine, when you'll flag where there's good performance, okay, or performance that needs improvement. And once we've done those two things and we understand what the benchmarks are, I think for us, the big lesson has been we cannot predetermine a decision that a program manager, a program coordinator needs to make. But what we can do is help them think about, if I see that this performance is doing, that this particular indicator, this particular metric is doing poorly, what are the things I need to ask myself about that data to help me understand why the benchmark is not being met? And once I have those answers, that's where I'll get the insight on what I need to do next. And it's the same thing for where there is, high performance. If I see high performance, what do I need to ask myself? What are the questions I need to interrogate about the data to help me understand the reason for those high performance? And if there's a lesson that we can learn there, that we can then apply in other places. And so, once we have developed this data to action framework, we then go through the process of configuring the information system, and configuring our dashboards. And we treat our data to action framework, or a D2A, as a living document. It's, we can keep coming back to it at a regular basis just to understand, are there things we need to change in it, especially as we start engaging with the data and making changes. And so as you go to the next slide, I'll show a snapshot of what it looks like. And it really seeks to answer, 5 broad questions, right? The first is, what's the indicator or the metric that you're interested in tracking? And we lay out even the levels of disaggregation, right? So one of our metrics will say the number of family planning client visits, and we're interested in looking at that, with, under 20s, 20 to 24, and over 25s. And so that's just, not just the metric, but also the disaggregation, you're interested in seeing it. We like the program team to articulate the reason why this is important, because we'll often hear of, data it's good to know, but, is that good enough for us to say, then this is important? This should be one of our key performance metrics, right? So clarity on why the data is important. And then we move to the action plan, which is what I was describing earlier. What are the questions based on the benchmarks you have? What are the questions you need to ask about the data? And there are some examples there that you can later see when the slides are shared on what questions for this particular metric the program team asks when the data is of high quality, when the data is above, when the performance is above the benchmark or below the benchmark. We then move to how the users would like to see the data visualized. And, as Emily mentioned, different people have different ways in which they want to consume your data. And often, as MEL practitioners, we think there is one best way, but some people may want to see things a little differently. So we take that into account and consult with them when we're designing the metrics that they care about. And finally, for us, because we're a global program, we want to understand which are the different places where that data is being collected. For you, it may be specific districts or specific provinces, but just think about the geographical spread of the data, and we can move next. And so once we've done that, developed the D2A framework, next slide, we then go to the process of visualizing it. And I use this visualization often as an example. This graph came out in 2020 when COVID was starting to increase. This was, I would say, April, May, and March, April, actually. And, there was a simple thing we're trying to communicate, right? What's the average number of deaths? That's on the y-axis. And on the x-axis, we're trying to communicate, have deaths increased day by day, right? And across 8 or so countries. It was called a tornado graph. And I'm curious as to whether anybody, and you can put this in the chat, if anybody can really tell us what's going on, right? And I think that's what the quote on the side is trying to say, is that there's no such thing as information overload. There's only bad design. And we'll talk about data visualization in a minute. But really the point is you want to be able to tell a simple story using your data, and it needs to be self-explanatory. Anytime I look at this graph, I honestly cannot tell you what is good and what is bad. There's just too much going on there. So I think let's try and avoid this and look for something slightly simpler in our visualizations. Next slide. And so, as we are developing our visualizations, we really are looking for a simple thing. We have raw data. We want to turn that into information, and that's what our visualization does. But the next step is really, can we turn that information into insight? And that's where, the users engaging with that data leads to that insight. And so, we typically follow 4 broad principles. The first is user-centered design, and I spoke about how we engage with them to understand their data needs and how they like that visualization. As we focus on key metrics, and that's how we identify those through our data to action framework. And like in the previous example, avoid too much information in one place. We try and keep the design simple with a clear message so that each visual you're putting on your dashboard will have a simple message or one message that it's trying to pass across. And then finally, we look to use appropriate visualization. And I think Emily spoke about that as well. And so go next. And so, I'm going to be, so once we have the visual set, we broadly look through, aim to drive data engagement at 2 different levels. So our core team, is a global team that focuses on managing the global program. And we worked with them at the beginning to develop this D2A framework. We worked with them to set up the DHIS2 data sets, and more importantly, the dashboards, and went through a series of reviews where users will say, I thought I wanted the data to look this way, but it's really not communicating to me, change this visual to be this way. And once we did that, we now have scheduled data reviews across countries. And it's really a deep dive at looking at the key metrics and asking the questions that had been outlined in the data to action framework. At a country level, they also adapted the data to action framework to their particular context, made the changes that they saw were required, and set up the dashboards. And then, because the data is reported on a monthly basis, there are monthly data reviews by the field. That's at the devolved structure, whether it's a district or province level, as well as the national level teams in each of the countries. And the focus of this data review is really just to understand, where are there areas of underperformance, what are the challenges that they're facing, and what are the needs that the program can begin to address. Next slide. So I'll just give 2 quick examples of extracts from our dashboard that are focused on particular data, just what you can see how we are using each visual. Each of these visuals is for one country. They are looking at client visits by age, and you can actually begin to see where things are growing or reducing on a month-on-month basis. But I'll do a bit of a deeper dive on how you can set this up in DHIS2 in the next one. Next slide. And then again, just a different example. And this one, the first one had relatively flat, a bit of an increase, but here you can actually begin to see where there are differences. And the way we have worked with our program teams is really ask them to do a deep dive. You can see the Mali data was relatively high and then sort of dropped off in 2023 and doesn't exist in 2024. So when a program person is looking at this data, they'll be asking themselves, okay, what happened? Why is there this performance? Is it driven by particular districts? What's going on in 2024? The idea really is to use the visual to ignite curiosity, because that curiosity in trying to find out what happened is what will help us understand, what was the underlying challenge there. And, Next slide. So instead of, I want to shift a little, and right now we've been looking at static graphs. I just want to move into a quick demo of how you can help set up your how you can set up, your visualizations in DHIS2. I'll be using a demo site. This is, by the University of Oslo, the makers of DHIS2, who have partnered with the Lao Republic to have dummy data that you can work with. And so I'll be taking us through the demo. But the second thing, for those who are curious and may want to know a little bit more, I'll show some links to the DHIS2 Academy where you can learn more. And so I'll just begin to share my screen. Dakota, you can stop sharing so I can share. And okay. So like I said, this is the site. This is the DHIS2 demo site, and the link will be shared there. You can log in. It's public. You can just use these logins. And for those who are French speaking, if you can use this username that has French at the end, and when you log in, all the menus will be in English, so you can use that. And like I said, this is the demo site. It resets every night, so anything that you do in here will reset every night. So you'll be able to save things, but you can download some of the visuals you worked on for practice. And the way DHIS2 works, for those who know, you log in and land on a particular dashboard that has multiple metrics, and I'll walk us through how we can set this up. But I think the key thing you want to do when you come into DHIS2 on the visualization side is, if I click right at the right-hand side, it will allow you to see multiple visualizers. What you want to click on is the data visualization app. So there are multiple applications within DHIS2. And, it typically, looks at 3 dimensions. The what, which is the data, the when, which is the period, if you can follow my mouse, and the where, which is the organization unit, which is either geographical unit, a health facility, a site, something like that. But I think the key thing I just want to show you here is, there are about 16 different visuals you can show, all the way from pivot tables to stacked bars, a gauge, scatter plots, etc. Each of them lists out, gives a bit of a recommendation around how it can be used, and this ties back to Dakota's presentation earlier around how you select the different data elements. But I won't go through the process of trying to do this from scratch. I think what I'll do is I'll just take us back here, and I will try and build a dashboard that tells a simple story. And don't worry about the naming. I won't use the right naming convention. This is just me trying to do this quickly. And so what I want to do here is, see if we can tell a quick story around immunization, right? And so I'm creating a new dashboard. I can either have created visualizations on the data visualization app, and once I have created that, I'll just come here to look for them. And so I'm looking for EPI visualizations that have been created. I want to put in a simple number here. I'll just click insert. And what this has is, the estimated live births this year. Let me just reduce the size of that a little. And so what it's telling me is that, 150 something thousand live births this year. Next thing I'm curious about is what's going on with BCG coverage. And so I can just search here for BCG coverage. And okay, there are two. One is the BCG coverage, and the second one is, the dropout from BCG to the first MR vaccine. But I just want to put this one in. And again, you can see I'm selecting numbers. And the reason why, there are different ways to do this, but let me just show you. We'll see how this comes together in a minute. It's really just saying that 75% of these estimated children have received their BCG vaccine. Now, the question then becomes, okay, is the problem, particular districts? Is it particular months? It's very difficult to just with this high level figure is great because it tells you there's a problem somewhere. But how then do I figure out where the problem is? And that's where the next level of the story comes in, of the dashboard comes in. And let me just look for one that has doses and coverage by antigens per month. Okay. Let me insert that. That is a table, right? And there are times when it's okay to have a table, I think there are times when a table can tell the story when you're drilling down a little bit better. And what this table does, unlike these lower parts that just have pure numbers, it's able to highlight for you, for example, there are particular months where across the board, there are low figures, right? And a quick tip is if you have a table, a people table in RHIS2, try as much as possible to use this traffic lighting system that says red is poor, green is okay, and this amber is sort of good. And so it's really helping you figure out, okay, yes, it seems that there are some particular months that have a problem. But again, the question we're asking ourselves as well is, are there particular areas or particular districts that have that challenge? And so I can try and get this data as a table as well. But if I'm looking at geographical spread, I think it's we also have the option of looking at this in a map, and that's a great one where this map exists. So I think I've inserted it twice. So let me just delete one. And I have this, so I'll just, beauty about the RHIS2 is it allows you to sort of play around with the space. And I can, actually, let me just save this now, just so that I don't lose on my work. But the beauty about the RHIS2 visualization module is that it allows you then to very easily customize your dashboard. So if I click on the edit button, I can come back and see, I don't like these empty spaces here, design matters as well, and that works. So final thing I can do just before I switch on to having questions is if you have an existing dashboard, right? Because for many of us, we'll be walking into a place and you already have a dashboard that's been set up. There are a number of things you can do is right from the dashboard itself. I can choose to open this in the data visualizer app. And once I've opened it, this is a place where I can start to manipulate my data. So for example, I only wanted to tell the BCG story, and there's all these other indicators here. So I can just click here on the data side, and it pops out this entire list of indicators and data elements. And let me say I am not interested in all of these, so I can get rid of them and potentially just leave those ones, update. And once I update, those are the only ones that will be left. And I can choose to then save these because right now the changes don't exist. Okay, so I can save it as a copy. Let me just leave my initials there so that I can find it when I come back to it. And if I come back to my dashboard by clicking that home button, I ideally should be able to come in, edit. Let me just search for the one that says WW. Okay, it is one of these ones. Ooh, sorry, I opened it instead of inserting, and that's the mistake I made. So let me just do this again. I want to insert it, and so it's inserted, and I will find it at the bottom. Okay, great. And so I can delete this one and just use my existing one. But I think the point is, we have all these options on the different charts you can use. I'd really encourage us to try out the DHIS2 data visualizer app. The link will be there. If you're wondering where to start with DHIS2, and this will be shared as well, there's on the DHIS2 site, they have an online training, and it'll be great if you can start with the introduction to DHIS2 course. And let me just, it's that fundamental course for someone who has not had any experience with DHIS2 and you want to learn about it. It takes a few hours for you to get to a place where you're able to use it. And this is what the site looks like. It's self-paced, self-explanatory. You can walk through this yourself, and within 3 hours, you should have enough information to know on what you need to do about DHIS2. And the second course I'd recommend is this Aggregate Data Analytics Fundamentals. Again, for DHIS2, it's available on their site, and you're free to log in and use it. So I think I'll take a pause there and hand the moderation back as we look to the question and answer session.
Thank you very much, Wycliffe, for the your excellent presentation and this demo of the DHIS2 data visualizer app. To get us started, I guess the first thing for just kind of going back to the beginning of your demo, could you just quickly show people, in case they weren't able to follow along, just how to log into this demo site and maybe show people how they can access the demo site in French?
I think you're on mute, Wycliffe. Sorry.
Sorry. If you just Google demo.dhis2.org, it will bring you to this site. And what you want to look for is this HMIS demo, right? And once you click on it, it will bring you here. You need to sign in with a username and a password. Let me use the French username. And the password is the same as what I had in there, is district 1. And so once I sign in, then it will take you in, and like you can see now, it will land you on the dashboard. And if I click here, it has all the different apps, and this is the data visualizer app that you could follow. And yeah, but let me just sign out as well. So it's the same process you would do for English as well.
Perfect, thank you. And I would just a reminder to everyone who's listening in on today's webinar is that if you weren't able to follow along with everything Wycliffe showed in the demonstration, that the recording will be posted on the Momentum website in the coming days. So you'll be able to watch the recording and follow along again. We are getting a few questions in the Q&A here for you, Wycliffe. And the first I'll point to comes from Luendo asking, can data from other sources be imported into the platform? I'm not sure if this question is referring specifically to the demo platform or to DHIS2 more broadly.
Okay. Let me, to DHIS2 more broadly, yes, you can import data from other platforms. Let me not there's this data exchange app that can help with that, but it primarily works through APIs, but you are able to import data from other platforms as well.
Okay, great. And then we have another question from Dr. Patricia asking, how can one overlay, for instance, BCG vaccine stock coverage with the performance on the map? Or how else could you illustrate it?
Okay, BCG coverage with performance. I'm not very clear what we mean. Is it coverage or with stocks as well?
Yes, with stock coverage with performance.
Okay, the challenge with that is, and I'll take you back to Emily's presentation, is that you'd want to do, it's difficult to, you can do it, let me first start there, but will it be very easy for it to communicate, two different metrics on one map? Because right now, what this is showing is coverage. One additional option would be just having two maps side by side, so you can do that visual comparison. If it's something, okay, that's one option. The second option is if you're loading something that's related to a number, you can then load that on top, and you'll have little bubbles here that show the size of whatever it is we are measuring. So there are two ways to do it, but typically we'd like a map to focus on one indicator, as opposed to multiple that becomes difficult to consume that data.
Perfect. Thank you, Wycliffe. So I see there have been a few more questions coming in the Q&A. We'll try to answer those in writing. Unfortunately, we are coming to the end of our session today. So I will hand it back over to Emily to wrap it up.
Maybe just a final thing is, the easiest way to get really good at this is it will take you 3 hours to do the introductory course, right? And a few hours to do the visualizer course. You will truly, it will be time worth spent.
That's great. Thank you, Wycliffe. And as I put in the chat, we'll definitely add those training resources to the to our list of resources, as I think they're important and we'll want to share those. Dakota, are you able to share just for the final wrap up? So I think with that, we'll close today on our final session of the series. All materials will be available on the Momentum website. I just want to thank all of you who attended today and have attended the other sessions and have been such an engaged and curious audience. I also just want to thank Zach Crosser, Dakota Hammond, Kadi Golia, Timar Fiseha, Stephanie Fisher for their work behind the scenes, supporting this series. And a huge thank you to all the presenters across the various Momentum Awards who were willing to contribute their time and expertise to these discussions, including Wycliffe. Thank you so much to all of you, and I hope you all have a wonderful rest of the day.